Hi, my name is Emily. I'm a family nurse practitioner student, and I'm here today to assess your musculoskeletal system. I'm going to start by assessing your upper extremities, shoulders, elbows, wrists, and hands, and fingers. And I'm going to first do that by just noticing how you hold your hands, if you hold them, and move them with an ease of motion. I'm going to palpate your hands and surface of your hands, notice any nodules, any inflammation, any erythema. I'm going to palpate your radial and your ulnar. Any pain?
No.
This is your snuff box. And is there any pain as I palpate that area?
No.
Okay. I'm going to look at the palm of your hand, feeling each side for any bogginess, any tenderness, any nodules. Okay. I'm going to come over here and assess the carpal bones, just distal to your wrist. Okay, and then I'm going to move down to your metacarpal joints, feeling for any nodules. I'm going to go ahead and squeeze your hands, again, further testing for any pain there. Okay. I'm going to move down to your proximal interphalangeal joints, and I'm just squeezing on both sides, testing for any pain, any nodules. And I'm moving down to your distal interphalangeal joints. Okay, good. Now I'm going to test some range of motion of your fingers. Go ahead and spread your fingers apart and bring them back together, testing adduction and abduction. Go ahead and put your palms flat like this and up to the ceiling and down to the floor and bring it back to the middle. That was testing adduction and abduction, or I'm sorry, flexion and extension of your wrists. Now I'm going to have you bring your palm of your hands out towards the ceiling, okay, back to center, and in towards the middle. Good job. Okay, that's adduction and abduction. Okay, I'm also going to test for carpal tunnel. There's two special signs that we do. It's the Phelan sign and the Tennell sign. For this, I'm just going to have you rest your hand like this, and I'm going to tap across the medial nerve. Any pain?
No.
Or tingling? Okay, let's try the other one. Any pain or tingling in
No.
your second, third, or fourth fingers? Okay. This is Phelan sign. I'm going to have you put your hands like this and press together. Hold it there for about 60 seconds. And again, if there's any signs of carpal tunnel, you'll feel tingling, numbness, pain in your second, third, and fourth fingers. Any pain, tingling, numbness?
No.
Okay, great. Those are negative signs. Now we're going to test, you can relax. Now we're going to test the range of motion of your thumb and your fingers. What I want you to do is make a fist, okay? And I want you to grip my fingers as tight as you can. Good, good strength. Now I'm going to have you touch your thumb to your fifth finger. Okay, now bring it back. Now touch your thumb to all of the fingers one at a time. And back. Good. Now I'm going to have you bring your thumb all the way to the... There we go. Now bring it back. You do that again? Any pain when you do those motions?
No.
Okay, great. Rest your hands on your fingers. We're going to move on to your elbows. And I'm going to begin by palpating some landmarks here. I'm going to palpate your lateral and medial epicondyles and your olecranon process and your ulnar nerve. Okay, we move on to the other arm. Again, palpating your lateral and medial epicondyles. and your olecranon process and your medial nerve. Okay, I did not palpate any nodules, any edema that would indicate anything like bursitis. I'm going to now test range of motion. I'm going to just gently support your elbow here, and I'm going to have you flex and extend. Any pain with that motion? No. Okay, let's move on to the other arm. Same thing, flexion and extension. Great. Now we're going to test supination and pronation. Go ahead and just put your hands out like this, and we're going to turn them up to face the ceiling and back down. The extremity musculoskeletal assessment is your shoulders. The first thing I'm going to do is inspect your anterior chest, just looking for any nodules, any swelling, any edema, which I do not see any. You can stay right here. I'm just going to come around to the posterior side and look at your posterior back, feeling for any abnormalities, nodules, or edema. Now I'm going to come to your supraclavicular notch and palpate on your clavicle. Is there any pain or tenderness as I palpate? No. Okay. Now I'm going to come to your posterior side, just stay right like this. I'm going to find your bony spine of your scapula and come up till I get the acromial and find that acromial joint. And now I'm going to come down the front to the coracoid process, and I'm going to find the tubercular, greater tubercle, and then the bicep tendon. Is there any tenderness there?
No.
Okay, I'm just going to come down the bicep tendon. Okay, now I'm going to have you bring your arm back posteriorly like this, and I'm going to palpate the delta bursa and the subacromial bursa, and palpate the sits muscles, which we'll assess in a little bit. Okay, go ahead. Now we're going to assess range of motion. So we're going to do a flexion and extension. I'd like you to put your arms out like this, raise them up to the sky, down to the middle, and down. Good. Flexion. Any pain with those movements?
No.
Okay. Now we're going to do adduction and abduction. Bring it to the side and up. Okay, good. Now I'm going to have you bring your arm across your body. Okay, other arm. Across your body. Good. Any pain with those movements? Okay, now I'm going to have you with your right arm reach across and up to your scapula. Okay, now come with that same arm and up to a stop sign. Okay, let's do it with the other arm. Back and up. Any pain with those movements? No. Okay, now we're going to assess the your shoulder for any rotator cuff, since this is the most common shoulder injury. We're going to do the Apley scratch test, which is where you bring your arm up over like this, like you're scratching your back right there. Okay, go ahead and do the other arm. Okay, good. The first thing we're going to do is test the supraspinatus muscle by doing the empty can test. What I want to have you do is bring your arms out here and place your palms out like this. And I'm going to put my hands on your wrist and try and press your arms out, and I want you to resist, okay? Good. Now we're going to test the infraspinatus muscle. And what I want you to do is put your thumbs up, make a fist with your thumbs up. I'm going to press you in and you resist, okay? Good. Now we're going to test pronation and supination, and I'm going to have you make a fist, and I want you to bring your arms up like you're holding a bowl, and I'm going to resist. Oh, let's start right here. Okay, I'm going to resist, and you bring them up like your bowl. Okay, good. The last test we're going to do is called the drop arm test. I want you to slowly bring your arms up and slowly bring your arms down. Good, you were able to do that movement easily. Now that we've gone through your